Dysautonomia Part 3. So unfortunately, it's a condition that many healthcare providers are not familiar with. Not many doctors see a lot of patients with dysautonomia. I myself, being in the field of medicine, did not really encounter any patients with POTS, ITS, dysautonomia, or maybe I just missed it. However, if you're looking for a specialist, a cardiologist is probably the most familiar with, a rise in pulse or a decrease in blood pressure that changes with positional variation. The treatment for dysautonomia is a whole lot of lifestyle modifications, which includes increasing the amount of salt and water intake. So obviously you have to make sure that your cardiac function at baseline is normal so that you can tolerate that amount of salt and water. And then compression stockings up to the waist are very, very tight and uncomfortable, especially if it's hot weather. And then you have to kind of pace your activities, have a notebook where you take note of your pulse and blood pressure when you wake up in the morning, throughout the day, take a lot of breaks, lie down, put your legs up. It's really difficult to carry on a day-to-day normal activity for a working professional who is managing a household and taking care of life as is. So dysautonomia requires a lot of changes, especially if you're diagnosed with it. And every doctor that I saw gave me a timeline of 6 months of recovery. They told me that, listen, long COVID is new. Long COVID dysautonomia might get better in 3 months, 6 months, especially because you were a fit and very active individual. I was and I am a dancer, a yoga practitioner, even a yoga teacher, very busy professional doctor, and was living independently, running a household, very social. And with this diagnosis, my entire life changed 180 degrees. It's 2025, towards the end of it, and I'm still living with this diagnosis and have to modify my day-to-day activities based on this spiking heart rate that makes it extremely uncomfortable to stay vertical for too long. Medication-wise, there are drugs that reduce the heart rate, and beta blockers are one of them. The one that I use is ivabradine. Ivabradine is a funny channel blocker, and that helps to decrease the heart rate and increases my tolerance for being vertical. I take a very minimal dose, like 2.5 milligrams twice a day, when the minimal dose is actually considered to be 5 milligrams twice a day. I've been taking it for about 2 years now, and with time and physiotherapy and rehab and a lot of different therapies that I have tried, the dysautonomia is getting better. However, it's an extremely slow and gradual process, and some people don't have symptoms after a couple of months or years, and some people live with it for the rest of their life. Some people have symptom-free periods, and then another illness causes a flare-up of dysautonomia. So unfortunately, it's a poorly understood disease that is only coming to light now because of COVID and long COVID.